And now, Yahala with Dr. Abu Shanab, brought to you by Bridgeview Chiropractic.
أهلا وسهلا مستمعينا الأعزاء في أول حلقة من برنامج ياهلا مع دكتور أبو شنب. ياهلا مع دكتور أبو شنب يأتيكم كل يوم اثنين الساعة 4:30 PM بتوقيت شيكاغو على راديو ياهلا فويس. والأهم من هيك إنه الدكتور رشيد أبو شنب هو راعي البرنامج، وهو رح يكون متواجد معنا في الاستوديو في كل حلقة من حلقات البرنامج ليشاركنا بمعلومات قيمة ومفيدة، ويعطينا استشارة مجانية في مجال آلام العظام والمفاصل. اسمحوا لي أرحب اليوم بالدكتور رشيد أبو شنب. دكتور أهلا وسهلا فيك.
أهلا وسهلا. شكرا very much for having me over.
شكرا لك دكتور. دكتور أبو شنب earned his doctorate degree from National University of Health Sciences in Lombard, Illinois in 1997. He was a faculty member at the school until 2000. He earned his degree as an independent medical examiner in 2004 and his master's in advanced clinical practice in 2012. Now, Dr. Abu Shanab has two clinics, one in Bridgeview and the other in Romeoville. Doctor, welcome to Yahala Voice again, and thank you for joining the team with your new show. I believe the information that will be presented during this show is of a great value and importance to our listeners.
Thank you again, and it's with my great pleasure to actually be hosting the show with you, and I'll do everything I can to help everybody to answer any questions that they might have about chiropractic and any injury that they might have.
Yes. برنامجنا معظمه رح يكون باللغة الإنجليزية لأن المصطلحات الطبية معظمها بالإنجليزي، ولكن نحن رح نحاول نشرح ونترجم باختصار يعني بعض المعلومات بالعربي. رح نتناول في حلقة اليوم موضوع في غاية الأهمية، لأنه للأسف كتار بيعانوا من هاي المشكلة، وهي آلام الظهر، ولكن مش الكل بيفهم أسبابها وشو هي الطرق السليمة لعلاجها. دكتور رشيد أبو شنب, today we will focus on back pain. So my first question, first of all, could you please explain to us at the beginning what is chiropractic?
Chiropractic in general, the word chiropractic, if we divide it into two, chiro meaning the hand, and practice meaning the study of or the practice of. So chiropractic in general is a natural method of treatment using the hand to help and to treat the human body naturally without the use of medications or drugs by restoring a normal function of the spine, normal function of the body.
Yes. بالعربي احنا بنترجمه العلاج الطبيعي أو العلاج باليد، وبرضه بيترجموه باسم العلاج بتقويم العمود الفقري، يعني انتوا بتظبطوا العمود الفقري عن طريق اليد.
Correct.
With the hand.
صح.
We would like to move specifically, I'm interested in our skeleton, the functions of our skeleton. The skeleton is our temple, let's say. We carry it, it's very important, and we don't really think about its function unless something bad happens to us.
Correct.
Yeah.
The overall, this is a very common question, and even in the clinic, people come in and ask, well, how many bones do I have? How, what's going on? The human skeleton consists of about 206 bones, and the skeletal system is divided into two parts. There is the axial skeleton system, which is your spine, your ribs, the skull, your breastbone, and the appendicular skeleton made of your pelvis, the arms, and the legs. That's very much the two systems for the human body, and that will give you kind of the shape of you.
So basically, is chiropractic involved in one area of the human body, of the skeleton, or in all those areas that you mentioned? Is it about only the spine or also the hands and the legs?
In chiropractic, we work on the body as a whole. Everything related to the human body, that's what we treat 100%.
Everything related to the human body. Okay, today we are focusing on back pain. So could you please, doctor, explain to us the anatomy of the back and what are the causes of back pain? Because a lot of people actually suffer from back pain without knowing anything about their back and where did those injuries come from?
The anatomy of the back, as we mentioned earlier, the whole skeletal system made of about 206 bones. The spine itself is divided into maximum of about 26 bones. There is about 7 bones in the neck and 12 bones in the middle back, which is like from your sternum all the way to the lower part of the lower back. And then the lower back itself, it's made of 5 bones. Then we have the sacrum and the tailbone. So 7 in the neck, it ranges between C1 to C7, the mid back, T1 to T12, the lower back, L1 to L5, and the sacrum and the tailbone. And nobody really, like you said, nobody cares about that until they have an issue.
Yeah, unfortunately.
Yes. Then this is where more common injuries happens are actually when somebody left a sofa or something to straighten up a rug underneath or move a soda from the car. They bend forward and they think there is a huge shot of pain so severe that they think they even broke their back. And this is a very common issue with muscles. So the muscles are the ones that part of the back anatomy that's more common to be injured.
Doctor, do you recommend someone who has an injury to go directly to a chiropractic or maybe go to a doctor using drugs, medication, or surgery?
Of course, this is depending on the patient's injury, but either way, they work. We have patients come in to us directly. We have other patients go to emergency rooms. We have patients come in after they see the regular patients. So it's really depending on the patient's background.
Who they go to at the beginning. Because I know you told me that you do actually referrals sometimes. There are certain limitations. For example, in your field, you say, okay, we can't treat this. This is someone else's specialty, maybe.
Correct. We have patients come in, for example, for neck issue or lower back issue. We find out there is actual kidney stones, or we have issues with thyroid, or something like that. We need to definitely refer the patient to see a urologist or endocrinologist or something of that nature. So depending on what we find on history and examination and radiologic findings, we refer the patient accordingly.
I noticed that chiropractic is very popular in general in the United States. People, even without injuries, they go and they visit the chiropractic and just to fix maybe their bones. It's like a regular visit. Is that right?
Yes, actually.
Comparing to, the other Arabic countries, for example, where I come from, where people, they don't go to the doctor unless there's something bothering them.
For chiropractic, it's actually it's the medicine where to restore the normal function for the spine. And for us to see certain cases, it can happen. However, we meant to see everybody for any problem. If it's a muscle issue, if it's a disc issue, if it's a joint issue, definitely we will have a method to treat it. And if we have a source of referral, we can definitely send the patient for a second opinion. Other things that can develop is the disc, which is a small gelatin area, sits between the vertebra. And as you hear, a lot of people used to say, oh, I used to be 6'1". I don't know what happened when I got older. Now I'm 5'4" and 5'5". So, yeah. And the issue is this disc, this gelatin, look like a sponge that sits between each vertebra in the spine, become a little bit smaller or herniated or bulging. And that would give you the word of arthritis or the slipped disc, or if there is a nerve impingement, when the bone itself or the disc itself hits the nerve, then you'll have a pinched nerve. And if this pinched nerve hits the specific nerve, like the sciatic, you'll develop sciatica. So the disc, it's very serious injury that we have to look into, as well as the muscles we talked about earlier. Then we have also the joints, which is what's like, it's a little joint, just like a plumbing, what's connecting the vertebrae together. And
these are all parts of the back, the anatomy of the back.
Yes, they are all part of the muscles, the joints, the discs, And those two together, everything together makes you move easy, and you'll be able to bend and twist, and allows your body to actually be capable of doing exercises and yoga and all the above.
Right.
The other part of anatomy that is really important, is the bones themselves. And the word arthritis develop as we age, or the herniated, as I mentioned earlier. This is also part of the anatomy that we really have to look into. Because the bone structure itself, a lot of people think just fracture. It's more than fracture. It's arthritis. It's bone spurs. It's a nerve damage. So definitely the bones are very important as part of the patient to actually take care of their bones, to avoid osteoporosis or any kind of bone disease, or any kind of the decreased calcium in that bone.
And how would the patient take care of his or her bones?
Nutrition is huge. You are what you eat. So if you are in good nutrition, a good method of food structure, that's what helps you a lot. Staying away from smoking, or some sodas or anything in that nature definitely will affect
Really?
your bone structure.
You never actually link the bones with what you eat. People usually think about, well, eating is more related to how you look like, or like a diet, but it actually also is very important, even when you're getting older, not only for kids, I mean.
Correct. Well, the thing about, let's say, drinking Pepsi or any kind of soda in general, affecting the thyroid gland, and that's developed possibly into diabetes or something, and that in relationship affects the bone. Patients who are they had like multiple C-sections or hysterectomy, the uterus in general have a huge amount of calcium. So people who have hysterectomy, they have a tendency more to have osteoporosis. So it is all related. It's all more what you do, what you did, what you ate, what you didn't eat, that help you out anatomy-wise. Also, not only with muscles, but with not only with bones. I'm sorry, but also with your joints and disc as well.
And yeah, so I would like to summarize regarding the anatomy of the back. Doctor, you mentioned it consists of course, the muscles, the joints, and the bones.
Correct.
And people have injuries in any of them.
Yes. The one more common to be the disc injuries. People who have disc bulging, disc herniation, with or without pinched nerve, that's very common to be the more common injury that patients present themselves to the clinic.
What about the injuries related to the muscles? Those are easier maybe to fix, let's say, than the injuries related to bones, obviously.
Of course, but the muscles usually are like I would say, like a dummy kind of thing. They are the ones who get hit no matter what happens.
Yeah, that's why we have muscles, right? To
yes.
protect the bones.
That's right. But the muscle treatment, it's a little bit less of time consuming and less of an effort versus a disc herniation or a pinched nerve.
So we would like to know more about the causes now of back pain. What causes? What are the, let's say, incidents that cause back pain in general?
The injuries are actually, it could be anything. It could be you just woke up with it. It could be patients who do any injury, like a car accident, a work-related injury, lifting. It doesn't have to be something heavy. Lifting like a 2x4 in bad posture versus lifting a 4x8 drywall, bending forward. So injury depending on what you do, what you've done. How did you stretch your muscles? Didn't you stretch your muscles? Did you run long? Injuries depending on what you've done.
And sometimes it's accumulated.
Yes, there's something called micro trauma and macro trauma. Something micro meaning you just did, or macro something you developed. Let's say you work and you keep looking at the screen, looking up the whole time. So you have 8 hours of looking at your computer screen with your head extended like 10 to 15 degrees. Of course, that will put a lot of tension on your neck.
Right, an injury could happen sometimes just because of sitting in the office for long working hours and your back is hurting, for example.
Correct.
Just from working. Okay, so now what does the chiropractic for back pain involve?
The chiropractic, first of all, we have to take a medical history. Just like you go to your regular doctor, the chiropractic doctors sit down with the patient and ask them series of questions about what's the history of the accident, or what's the history of the injury, what did you do, um, did you lift, did you pull, what makes it better, what makes it worse, does it go down the arm, does it go down the leg, does it give you headaches? So the history is by far 90% of the diagnosis generating. Follow the history, we do the physical exam. And the physical exam consists of a nerve test, orthopedic test for the bones and the muscles and the joints, as well as chiropractic examination, range of motion examinations. We ask the patients to touch their toes, to look up, look to the sides. We also do diagnostic imaging like X-rays, CT scans, MRIs. We do sometimes required nerve testing, like something called nerve conductive velocity or electrical myograph, EMG, definitely to help out with the diagnosis for the patient.
I wanted to ask about maybe the exercise that if someone has a disc, for example, do you give suggestions regarding the exercise that people or workout that they could do or that they can't do?
The sooner the patients perform the exercises, actually, this is gonna speed up with the treatment protocol for the injury. We have a lot of people coming in with they just like lifted something the day before or they pushed something. They come in and instead of being straightforward, they actually tilted. And the treatment of choice is to actually perform exercises to restore the joint and the disc itself to normal function. So restoring the patient's ability to do movement and to do exercises is the treatment of choice for many conditions. Some other cases, I don't recommend do mobility to it. And let's say if somebody with a car accident where their head went all the way forward, all the way back, so it looks like
Ouch.
it looks like really hyper active. It's moving a lot. So
Yeah.
something like that, you have to brace it. You have to put like a belt around it, not belt, but like a cervical collar, neck collar to hold it
like a
in place.
protection.
Same thing for the lower back. You use the lower back belt. But most cases, we definitely ask the patient to perform some physical therapy modalities and physical therapy exercises to restore normal function for the joint.
I heard that swimming is the best exercise maybe for people that have back pain. Is that right?
Swimming, it's actually a great method for it. The idea with swimming, there's no weight bearing. You're not lifting. You're half your body size in there. If you're a good swimmer and you're able to perform it,
Preferably.
yeah, we have some patients drown in the
Oh
shower.
my God. They have one problem, now they have two, right?
So swimming is really a great method to perform. In addition to swimming, massage therapy is excellent. Certain medications, possibly over the counter if needed. Physical therapy by far, like using a simple ice pack to treat. Something just got pulled this morning. That will be great. Hot pack, some exercise programs, acupuncture. The sky is the limit with the treatment for a certain condition, but you just need to know the diagnosis. You need to know what caused it, and we don't want you to do further harm.
يا هلا مع دكتور أبو شنب، دكتور العلاج الطبيعي ومعالجة العمود الفقري باليد. دكتور، بدنا نحكي هلأ نركز على علاج آلام الظهر عن طريق الكايروبراكتيك. What are the treatments of back pain with chiropractic?
A treatment to offer, actually, depending on the diagnosis. After we determine the cause of the problem, we have to go and actually fix the cause of the problem, not the symptom. Meaning we are not going after to see certain muscle hurts. Okay, let's decrease the pain on that. No. We want to go after what caused the bone to be out of alignment, what caused the bone to be painful or the muscle to be inflamed. So knowing the cause and the diagnosis is what's going to help the patients the most. Other methods that we do to aid us with treatment, as I mentioned earlier, is the physical therapy that will employ massage, with different types. deep tissue or superficial or just a regular trigger point for the muscles. The use of something called ultrasound, which is a physical therapy modality, which is a heat wave. It's not like a normal ultrasound where somebody pregnant or with television and stuff. No, no, it's a gel, same method that we use for patients who are pregnant and go into the OB/GYN for that. It's more muscle treatment using the ultrasound heat modality, as well as something called electrical stimulations, which is like a little pads we apply on the patient's neck or lower back, and we stimulate the muscles to re-educate and to increase circulation, as well as we employ a lot of exercise programs to help to regain full use of the neck muscles and the lower back normal range of motion. So the exercise not only restore function but also strengthen both the abdominal and back muscles to help stabilize the spine, to help stabilize the joints and the discs. So the more strong you are to prevent further back injury by learning the muscles and doing gentle stretching and proper lifting techniques, that's maintaining a good posture.
That's right, because I always hear it's the best thing is to practice and to strengthen the muscles, especially the muscles of around the spine, in order to have a healthier spine.
Correct. And the reason we use different methods because each person is different. Some people do well with physical therapy, some people do well with chiropractic manipulations, but other patients who we cannot use such treatments. So we really have to think about possible acupuncture, which is, the Chinese needles.
Do you do that as well?
Yes, I do that as well.
Okay.
And we apply that toward in the neck, lower back, the abdomen, any place. And it's not only for pain. Maybe we'll revisit this acupuncture in the future. But the acupuncture, it's by far a great method, and there is too many studies about that, how acupuncture can help patients with injuries, work injuries or auto injuries or sprain and strain or anything in that nature, but acupuncture recommended for a treatment protocol as well. Some other patients that we do treatments for may require injections and some others may require surgery, but those numbers, of course, vary depending on the patient's age or injury.
Yeah. Doctor, you mentioned that the treatment of the back pain depends, of course, on the injury. What are the most common injuries that you see in your field?
The ones we usually see here are disc injuries. Patients come in with numbness and tingling in the legs. That's one. Over 80% of our practice is seeing lower back injuries. So if we just concentrate on lower back, I think that's the ones that most common. But in the same thing, we see other patients come in, they woke up funny or their neck twisted, they can't turn when they drive, they're unable to do it. بيسموها زي ما تقولي لفحة هوا or something like that.
نعم.
There is something like that. Patients come in with it, but
It happens a lot to me.
come in. You should come in. Definitely.
Or the pillow is not very comfortable sometimes, the way you're sleeping.
Yes, if the pillow is too high or too low, it's the same thing. Or some people sleep on the couch. If that's another approach too that give you injuries with the neck.
So how do you treat these kind of injuries? من لفحة الهواء.
لفحة الهواء, it's actually self-limiting. It will go away by itself 2 to 3 days. But what we do most common to be massage therapy, we do the traction, something called decompression, when we stretch the neck the opposite way, of course, patient tolerance. But the most important treatment is the sooner you come in, the better it is, and the sooner it will go away.
Right.
But you come into the office 2 weeks after it happened, it's going to be really hard to restore.
It is, because I know people, they went out wearing a very light jacket in a, minus 20 Celsius degree outside, and صابتهم لفحة هواء في ظهرهم, or it stayed for over a year, the pain.
Yeah, that's a little bit advanced and a very serious issue. So definitely we need to look into that, especially if it's taken that long. That's we need more than just regular treatment. We have to look into it further.
That's right. I wanted to ask about the ages, the people that come to your clinics. What are the age groups usually that you treat?
Um, not only me, but many chiropractors. My youngest patient was 3 days old, and I have patients who are 97, 98 years old. So, and not everybody comes in gonna have their neck and lower back adjusted and popped and everything else. Of course, you got to be careful of what you're dealing with. If you're dealing with somebody who was 300 pounds versus somebody who's 40 pounds.
Yeah.
If you're dealing with you can't just apply the same amount of pressure and treatment
Definitely.
for everybody. But the patient's age and it's not really too much related to how they look like or what the x-rays look like in their history. So depending on the patient's age, if they have osteoporosis or not, if they have too much arthritis or not, the treatment depending
On the patient, on the let's say the injury or illness itself, not on the age. That
correct.
what
And
you mean?
also we have patients who are 70 and 80 years old, but they look like they are 40. And you have people who are 40 years old, but they look like 70. So it depending on how the patient is, how's their food, what's they eat, what the blood pressure, diabetes, it's all related.
So you have different ages coming to the clinic, but I know I've heard that in a certain age, when you're under 16, your bones are still growing and the bone structure is not complete. Does that actually affect the way you treat those kind of patients?
That's really a great point. We see a lot of patients who are less than 16, their bone structure is not fully developed. And those are the ones we really have to kind of handle with care.
Yeah.
Because if you think about it, it's those patients are like a tree. The way you put them in, this is the way they're going to grow. So if a patient who are like 12, 13 years old, like slouching and the backpack's too heavy and stuff, of course that will affect the way they grow and the way they're going to slouch, and they might develop something called scoliosis, which is curvature of their spine. So the more, those are ones that we really need to look into and be sure that they are being examined. We have to look at their feet, we have to look at their back, they have flat feet, not if they're slouching, if the backpack is too heavy, if the patient himself is overweight. It's very important to actually look at those,
To study all those factors and elements.
especially at a younger age.
دكتور أبو شنب متخصص في العلاج الطبيعي والعلاج اليدوي وتقويم العمود الفقري. دكتور أبو شنب, we have maybe a couple of questions left, and I would like to ask about the relationship of the feet with back pain, because you mentioned that you have cases of flat feet, and it also actually affects on the back.
That's really important questions, and a lot of patients who come in, and when we do the exam and we do the history and the X-ray, we find that there is one leg shorter than the other due to a possible flat feet or due to previous injury like a knee or a foot injury. But people forget about it. Then down the line, you'll see when you take the X-ray, their spine is crooked. One leg is definitely higher than the other. More common to have is actual flat feet. So you stand on your feet all day. So the feet are actually like the foundation of you. So if the foot is not structured correctly, or all the weight is on one foot versus the other, that by far going to affect the spine and affect your mid-back and affect your neck. So the feet relationship with the spine is not excluded. We have to look into it. And in our office, every and single patient that come in, we check into their feet and look into their posture, look in their how much weight they put on the right foot, how much weight they put on the left foot, and we do adjustments accordingly.
شكرا لك دكتور رشيد أبو شنب, شرفتنا في راديو ياهلا فويس.
Thank you for hosting me.
Thank you مستمعينا الأعزاء, وهيك نأتي لنهاية حلقة اليوم من برنامج ياهلا مع دكتور أبو شنب, مني ومن أسرة البرنامج أطيب المنى. إلى اللقاء.